Met Tom almost 15 years ago. A little bit of story about me. I went to the Kansas City Chiefs, was living in this hotel, and I think I might have told you guys I ended up getting sick. There was mold and in the AC, and one of the people that worked there got Legionnaire's disease and ended up dying. Well, I ended up going back and playing for the KC Chiefs, and over the course of the season got sicker and sicker and sicker, ended up tearing a hip flexor and going on IR, and all of a sudden I started looking at all these different symptoms, and I went to the internet and I actually entered my symptoms into Google, and it told me I had leukemia. And I was like, oh shit, I got leukemia. And I called up one of my closest friends in the world, a guy named Bob Sapp, who's a professional fighter in Japan. Those of you guys have probably seen him, Bob the Beast. He's like 6'4", 400-pound dude. I call him up, I'm like, Bob, I got leukemia. And he's like, bro, you ain't got leukemia. And I'm like, something's wrong. And he was like, you know what? I don't know what's wrong with you, but I know a dude that can figure it out. And he's like, I want you to call this guy. So I called the guy up, and he's like, where are you? I'm like, oh, I'm in LA at my parents' house. He goes, I'm in LA. And I'm like, where? And he's like, at the Comedy and Magic Club in Sunset. Do you want to come meet me? And I'm like, yeah. So I jump in the car. My parents live in Palos Verdes. I drove up to Sunset, and this dude comes walking out of the Comedy and Magic Club, and we do the consult in the parking lot at like 10 o'clock on like a Friday night, and we're sitting out there like rapping about all this stuff, and he's like, I got you covered. I'm gonna be home. Come to Arizona, come to my clinic, and we'll do blood testing. So Tom's clinic is really his kitchen. So I literally go to Arizona, pull in, and I'm kind of embarrassing him, but literally he had his clinic in his kitchen, and he took 70 vials of blood off me that day, and I almost died. Got in the car and had to like go sleep at the gas station because I was so like, tapped out. And I go back a couple weeks later. He gives me like a phone book of my blood work, and he's like, "Here's your baseline. You don't have leukemia." I'm like, "Oh, thank God." He goes, "What you do have is toxic levels of every type of mold I tested you for, and every system in your body shut down." And I was like, "Oh shit, what do we do now?" He's like, "I got you covered. Let's do some IVs, give you some supplements, antivirals. I want you to eat the inside of every piece of citrus fruit you can find, like oranges, grapefruits, all that stuff on the inside. You'll be fine." Literally, in about 3 or 4 weeks, IVs and everything, all of a sudden I bounced back, and at that point, he has really been my guru for everything, blood work, supplements, and I mean, he's my one lifeline. They said, who wants to be a millionaire? If I'm sitting there, it's probably going to be Tom. So, and he's, worked with me not only my whole NFL career, but worked with just about every professional athlete of any worth, and really count him as not only a good friend, and if anything were to go wrong with my kids or my parents, and things have, he's the first guy I call. So I'm really excited to hear his talk. I know he's been really talking or working a lot on genetics and trying to really look at cancer and illness and some stuff. So really excited for this presentation because I know he's been working on it for a while and presenting some really kind of cutting edge information that I don't think anybody in the world's heard yet. So count you guys self as lucky. I'm going to sit back in and strap in. Thank you.
Thank you, John.
Yep.
So a little bit of like story before the story. At the time I had met John, I was traveling all over the United States, kind of like a human pinball. So imagine, if you will, someone on a very large newspaper route. And basically my function was at the time, as I would go to doctor's office around the country, I would walk in and I would be operating like in a closet. I might have a desk in a strange room, and I'd have patients lined up, and for that doctor's office, I had to quickly figure out what to do to help these people that were not responding to traditional medical, like allopathic care or medical approaches. So I had colleagues that were chiropractors, osteopaths, or allopaths, which most of you may know as MDs. And so imagine, if you will, you walk in and there's a line of people and you have to take care of all of them, and you know nothing, you don't know their name, their history, etc. And so one of the things I learned from a long time ago when I worked with the Pittsburgh Steelers is the more things I could measure on someone, then the better I could understand that body, and then I could better figure out what tools society has to offer to help that person. So I originally started with measuring vitamins and minerals, and my research group at the time, we led the world in publishing research on how to naturally increase testosterone levels. And most of you guys aren't as old as I am, and one of the... Sure, is that better?
I don't know, is it better, guys?
Sorry? And at the time that...
That's
okay.
I'm just going to manhandle you.
That's right. I'm used to people touching me. Okay.
Guys, is it any better? Sorry about that. Let's go. Yeah, talk to.
Okay, so at the time, research was just really getting started with lifting weights, and there was this thing that lifting weights would make you muscle bound, and because of certain society cultural challenges, women were not allowed to lift weights because they weren't supposed to sweat, and so we got hired by the United States Army to figure out how to make the average woman stronger than the average man. And so at the time we were strength training women, everyone said there's no way a woman could be stronger than a man. And everyone had said that was wrong. At the end of 6 months, we had the average female in the study stronger than the average man. Then shortly after that, we were in a position where we were able to strength train men up to 105 years of age. And we were able to show that at 105 years of age, we could still add muscle to them, to those guys. So now we know age is no longer an excuse, right? So when people say I'm getting older, well, you're not 105, so you really don't have any excuses why you can't do it. So my reason for sharing the story is because I got an opportunity to work with some of the brightest minds in the world. Even last night before coming in, I was on the phone with some of the top experts in the world in genomics from Harvard and Stanford, looking at how they approach certain things. And some of the data we've been able to accumulate on people is life-changing, and it goes against a lot of what you hear. This is not 4-hour body bullshit. This is not Dave Asprey's bulletproof executive nonsense. This is real science. This is stuff that if you understand it and apply it, you could not only change your life, but you could maybe save your life or someone in your family. So what I'll do next is kind of go through the slides, and I'll stop along the way to kind of give you an outline for today. And I'm going to bounce around a little bit because it's really difficult for me to share all the information we've accumulated just in 2016 alone, let alone all the years before that. So a lot of times people bust on me when they come to my clinic. I have hundreds of certifications. I do not encourage people to spend that much money on the certifications. I've probably invested about $6 million in my own health. I probably invested about another $2 or $3 million in my continuing education. Every 3 months, I go for another, I would say 32 to 40 hours of additional education in new technologies I know nothing about in the healthcare setting. So most of my friends, when they come over, they bust on me because there's all these pieces of paper on the wall. And the joke, of course, is the more the credentials, the less the credibility, right? So what we'll do next, let me backtrack 1 second here. My company was previously called Human Performance Specialists. And the reason why it was called that name is at the time, I was working with mostly NFL athletes. And my job was to take these freaks of nature, guys like John, and make them even freakier. How do you take a 300-pound guy and have him running, a mile, maybe under 6 minutes? Or how do you have a guy benching over 600 pounds without drugs? And so what I was able to rationalize and figure out, if I measure enough things inside the body, I could understand what was holding back that person the most. And it was way ahead of the curve. Most people, when they would hear, oh, vitamins and minerals making you stronger, they couldn't have a reference point because they never had a scientific basis for their own decision making. They would simply read something and then try it. And if you don't know by now, that doesn't work. The research is very clear. You cannot take data from a different body and extrapolate it to another body. So we're now reassessing many of the original studies on dietary supplements, even exercise programs. They're no longer valid because we know more today. So you guys today should know more than you did, let's say, a year ago. But a year from now, you're going to know even more than you do right now. And as part of your growth and your education, you now have to constantly reassess, what am I doing? Is it scaling and moving ahead with the growing body of information? Do you know that by the time, say another 3 to 5 years, there'll be more new information coming out every day than there may have been in a 10-year period before that. And by the time we get to 2050, there'll be more information coming out in an hour than all of mankind's history before that. So how are your minds able to handle all this new influx of information? Most people haven't considered, how do I scale what I'm doing so I could rapidly integrate new stuff so I'm always on top of my game. So because many of our patients had said, wow, you were the only guys to figure out the root cause of my issues holding me back, either in athletic performance or with my illness, we winded up changing our name to Causenta. So the idea is Causenta stands for the root cause of. So that's why you would see that there. So the outline today, oh, I'm sorry, so watch. The outline today is I was going to originally have a demonstration. One of the things I know I've learned from talking to people and professionals all over the United States, and even right now, how many people have been taught how to get out of pain? Anyone? Without a drug or a supplement. So right now your back's hurting you. What has someone taught you to do? Ben? Okay. And after you are done, is the pain gone? I'm not sure. So there's lots of ways to help people get out of pain. And I want to maybe first approach it from like more of a philosophy perspective before we get into some of the science. So imagine if someone was dying right now. This person's dying, and let's just assume for the sake of science that it is absolutely 100% true that nothing could be done to help that person. We could still be kind to them. We could still say, hey, I'm here for you. I'm going to ride this out with you to the end. And that would have some positive impact. Would everyone agree? So my main point is that even when there's nothing that could be done medically or scientifically, the reality is that we could still do something. So what that means is that there's always something that can be done. And so if you accept that, that means anytime you are faced with a problem or a challenge, you always have the mindset that allows you to see a solution for that problem or challenge. What's been very disappointing for me as a professional, as I've integrated and interacted with physicians all over, is how many times they would say that nothing can be done. And so I would ask them the logical question, have you done whatever? And they would say no. So then I would say, well, how do you know that it won't work if you haven't done it? So one of the things I would like to maybe pass on to everyone here to expand your mindset is that there's always something that can be done. And so if you go into, whether it's training an athlete, whether it's working with a family member that has an illness, or anything else that you guys encounter in your responsibilities, there's always something else that can be done. And once you have that sort of mindset, what tends to happen is you find answers and solutions to problems as opposed to missing them or ignoring them. So I was going to do a demonstration, but because of some of the time, I think what we'll do is I'll go through some of the information first, and if there is time at the end, I'll then do some practical stuff. I assure you, anyone that's going to be in the gym tomorrow, I'll have lots of cool stuff I could show you. So next I'll talk about sleep, nutrition, and then go through the rest of the presentation. So one of the first things I thought would maybe talk about is I talk to people all the time that say, hey, I'm going to do this. And before the conversation is over, I already know they're going to fail. And it's not because I'm negative. It's not because I want to wish them bad will or bad luck. But it's because I understood that for you to get a positive change in a given direction, the first thing that has to change is your own behavior. So as an example, if I say, hey, I want to get stronger, and you say to me, when are you going to work out? I'm going to work out at night. And you say, well, when is your energy level the highest? And I go, in the morning. What's the likelihood I'm going to be able to commit to working out at night? Not real good, because I'm tired. So I haven't adjusted my behavior to allow for that to happen. And when clients come in many times, because of our research and our accomplishments with other people, what they assume is somehow I'm going to give them a magic pill. I'm going to give them a diet, an exercise, a pill that instantly will solve all their problems. And there's a loss of awareness that, well, for that information to help them, the first thing that has to happen is they have to change their behavior. So if they're not willing to allow for the time it takes to work out, if they're not willing to allow for the time it takes to go grocery shopping or hire someone to shop for them to get them the foods that they need, it just isn't going to happen. So when I looked at stuff that was commonly found on the internet, what I hear a lot of times is stupid things like 30 days to make a habit and stuff like that. And the reason why I say it's stupid is because it's simply not true. There isn't any research at all that even supports that. It's just simply books that unfortunately are popular. And so what I wanted to make sure everyone had an opportunity to see is there's an actual scientific model from a doctor from Stanford that's very highly regarded, Dr. Fogg. And essentially the equation is B equals MAT, B equals behavior, M is motivation, A is ability, and T is triggers. And let me give you a practical example of how this stuff works. Oh, by the way, Luke is free to give this presentation out to everyone, so you don't have to worry about necessarily writing down every little detail. I'll make sure you have it available. And imagine if anyone here that drinks alcohol that has children, maybe in the front row. Okay, so let's say if I said, hey, I'd like you to stop drinking alcohol for a year. Say, okay, sure, maybe 3 months into it, you might start drinking, right? It's like, he's not gonna know. But imagine if someone threatened your child and said, if you ever drink again, something would happen to your child. Do you think your motivation to avoid drinking would be higher? Yeah. So that's the purpose of this example or this equation, is that once you understand what helps the behavior change is the motivation and the trigger and the difficulty, if it's something that's going to really challenge your abilities, it's going to take a lot more motivation and much stronger triggers. I share this because once you're aware of these factors, it now becomes very easy to change your behavior. Once it's easy to change your behavior, the sky's the limit. There's nothing you can't do. So as an example, we have a patient right now. I have 15 patients that had spinal cord injury that could not walk. They are now walking. This is my 16th case. And so my goal is that this woman will be walking again. So in order to really help her get to where she needs to go, one of the first things I realized is her mindset was not in the right direction. And the second was that she wasn't making the changes in her behavior. She was not getting enough sleep. And as you'll see in some of the later slides, sleep is critical. It's directly linked to muscle mass, testosterone, and strength. So if for no other reason, you want to make sure you have good sleep. But what we started doing with these patients is making sure that we help them to create the environment for success in their personal life. And how many people here work with others like maybe 3 hours a week or so? Is that a standard time, or am I missing something? Maybe like an hour 3 times a week? So if you look at the relative amount of time someone has in their week, how much impact do you think 3 hours has compared to, let's say, 8 hours a day times 7? It might have some, but it's not going to have as much long term because simply the volume of time is stacked against you. So I'll share with you some of the cool technologies we're doing in the future when we get to the sleep stuff. But what I wanted you to just take home from this is that behavior is probably the single biggest thing to work with in any client. It ultimately determines the success or failure of your training. And despite that fact, most of the time when I talk to coaches and trainers, they're more focused on details like sets and reps, workload, volume, things like that, fitness capacity. And they're not seeing the big picture that if this person's behavior doesn't change, they're never going to be able to stick this all the way through. And you would analyze the effectiveness in your own work world based on member retention. How long are you keeping your clients? Or do you have a lot of people that stay for a long time, or some leaving? If you have a lot stay a long time, then you may be able to make an impact on some of the behavior. So let's skip past this for now. Okay, so I wanted to, on the sleep side, the reason why I talk about sleep, it is the number one thing we find with every person that comes in our building. So it doesn't matter if the patient is coming for cancer, doesn't matter. Most of the guys that come into our clinic, they're looking to raise their testosterone. So I'll share with you some sort of like trivial pursuit details. If a man is injecting testosterone, so he's physically putting in 200 milligrams of testosterone a week, if he has a sleep disorder, sleep apnea or insomnia, over time he can still develop erectile dysfunction. So I want you to think about that. Sleep is so powerful, it can negate the effects of testosterone. So if you want to really maximize the results or the benefits of testosterone, the first thing to do then is make sure you have good sleep. But when I talk to couples, typically I'll talk to a man, say, hey, do you snore? Do you have any trouble breathing at night? And the man usually says, no, I don't. And then I look to the wife. I go, does your husband snore? And they almost always say, yes, he does. So I like to interview couples simply because we know that we understand how the brain works a little bit, and we know some little more trivial pursuit details. If the brain was a computer, it would process 700 billion to 700 trillion bits of data per second. Those are big numbers. Now, when we talk to someone and we say, wow, this guy's really smart, he knows a lot, how many numbers do they have to remember before we think that? 10, 20, 20 numbers? That's a huge gap between 20 numbers and 700 billion. So what that tells us is that even when someone is 100% open and forthright and fully coming with their information, people don't know everything going on in their own body. There's too much happening for them to pay attention and process it all. And the reason why I share that is because what does everyone go by? How they feel. So we already know just going by that alone, they're going to make a lot of mistakes. So in terms of the nervous system, anyone know what the number one priority is? Any guesses? I'm sorry, staying alive? No, well, think about different systems in the body. It's like, you know, within the nervous system, you have your different senses. So anyone have a guess which one would be number one? So it's vision, it's number one. How about the second one? Now to kind of give you a hint, be inner ear function. And then third is proprioceptive awareness, or maybe touch in some cases. The reason why I share that is the brain dedicates maybe 70 to 90% of resources to vision. So if you want to improve athletic performance in any sport, if you want to improve health with any disease, one area to really address, spend time on, is vision. Now, if you look at your programming with your clients, the one thing you may want to look at is how much time are you putting into vision drills. Why you would say, well, I have something on sleep, why would I talk about vision? Because when there's a sleep issue, one of the first things to go is vision. So what that means is that the sleep issue is creating a problem that's affecting the nervous system. Now, how well is someone going to perform in any sport or deal with any disease if their nervous system is stressed out? And we measure a lot of markers in the body. We also measure a lot of things within the nervous system. And one of the things that what I found was really surprising, 100% of the athletes that we've been evaluating with some of these newer methods, 100% overtrained. And when I asked every athlete, how do you feel? What do you think they said? I feel fine, I feel great. So they are conditioned to feeling overtrained as being normal. So when these are elite level athletes, so regular people are probably going to be less aware of their body. So how are you going to be able to help them if they don't know what they're feeling inside or what's going on? Tomorrow I'll be able to show you some cool stuff, and maybe at today's presentation. So the things about sleep that I thought were really fascinating, for people that don't get enough sleep, they lose muscle even when they're lifting weights. So typically, I get questions from guys on, what supplement should I take? Guys that are older, maybe what hormone replacement therapy and stuff. And they miss on a big winner, which is sleep. And the other thing about it is sleep, it affects basically 1/3 of their lives. So it has a better impact. Some other things that showed up is even within inside the cells of our body, so let's say inside your muscle cells, if we look at the mitochondria, sleep disturbances, some sort of altered sleep, actually impairs the ability to make energy. So if you kind of summarize some of these findings, and there's a diagram there that shows how sleep affects hormones and some other things. Less muscle, weaker, slower metabolism, slower movement, and obesity. Now this is just sleep. When we factor in some of the data from the microbiome and some of the biases from different types of organisms, and from some of the data from guys taking branched-chain amino acids, you'll see you could actually make someone fatter even faster. which definitely is not going in the right direction. So what I thought, let me see here on the next slide, one of the questions I often get asked is, how do you know if you're getting the right amount of sleep, or how do you know if you're sleeping well? So we actually have technology. It's basically like a little, sort of it is like a little transmitter, receiver type gadget that you would wear, and it has a belt that goes around your chest and measures the expansion and the contraction. So your chest going up and down. It also measures airflow through your nose, and it measures the oxygen concentration, or it has a pulse oximeter. And you'd want to do a sleep assessment in your own bed at home. You don't want to go to a sleep center, and the reason is we cannot distinguish then a sleep issue because of a strange environment versus a sleep issue that you actually have. Unfortunately, because of sort of the way that insurance runs, many centers set up these sleep, they have these sleep centers that you go in and they measure a lot of brain activity. And they do that because they could bill insurance much more money. But let me assure you, the last thing you want to see is a problem with your brain when you're sleeping. By the time it gets there, it's kind of late. What you want to find out right away in the airflow. Now, I mention this because these tests are pretty inexpensive, maybe 180 bucks. So for about 180 bucks, give or take a few dollars where you live, maybe some shipping and handling fees, you could actually find out just what's going on with your sleep. Now, I'll share with you, years ago, I thought I had a sleeping issue. And I had went to a sleep center. They tested me, and they told me there was nothing wrong. And I didn't know enough about the technology at the time. I had just set a bunch of records in powerlifting, and I was just kind of getting into strongman competitions at the time. And I remember one night laying in bed, and I felt like someone was choking me. And I was living with a woman at the time, and I can remember looking across the bed to see, was she pissed at me? Did I do something wrong? You know? But I really felt like sensation of hands on my neck. And you know, she wasn't choking me. So I go and get another sleep study done. And again, they say, there's nothing wrong with you. And I go, there's got to be something wrong, because if I feel like I'm choking and you're telling me there's nothing wrong, there's got to be something you're not measuring. And I didn't know enough about the methods at the time. So years later, I was being interviewed to be on a Dr. Oz show, and I wind up meeting the sleep doctor, Dr. Michael Bruce, for Dr. Oz. And Dr. Bruce was a pretty sharp guy, and I started talking to him. And he's like, hey man, those clinics, forget about them. Here's why. And he shared with me the information I shared with you earlier. He goes, I'll test you and we'll go over it. So he winds up setting me up with a home kit type of thing. I get tests at home. And I find out I stop breathing 32 times an hour. So every hour, I stop breathing 32 times. Now, to put things in relative perspective, 5 or 6 is normal. So like in that transition, when you go from a conscious state to an unconscious state, you're supposed to have a minor apneic event. As you kind of go through different cycles of your different stages of sleep, there's supposed to be different systems or different regions of your nervous system taking over. So it's normal a few times, but not 32. So he calls me really concerned, and he says, hey man, 32 times an hour, that's pretty serious. And I told him, finally, I am so happy. And he goes, why are you happy? You're choking out. I said, because for years, I've been telling doctors I can't breathe, and all I kept hearing was, there's nothing wrong. And now I have an objective tool that I can use to evaluate myself and see if what I'm doing is improving. So since then, I no longer, I've been able to improve my sleep, so I don't stop breathing 32 times an hour. So acutely, if someone does have a sleep issue, we would use a CPAP. As we work with that person, we would actually have them do exercises to improve their ability to breathe. I get asked all the time by people, should I do a dental, oral device? Should I get surgery? And my recommendation is typically no, because if you didn't need that stuff years ago, you shouldn't need it now. And because those tools do not address what's changing in the body. Most of the changes that people go through that result in sleep apnea later on is changes in the brain. So to put a device in someone's mouth or to surgically reconstruct their nose, to me that is medically irresponsible. Unfortunately, insurance covers that in some cases, and it takes too much time and attention to detail help people work through the challenges with their nervous system. So if you did have sleep issues, a very tiny amount of melatonin. So scientists at MIT showed you only need about 0.1 milligrams or 0.3. It's a really tiny amount to actually help you go to sleep and get your sleep back on track. If you have cancer, arthritis, or serious health issue, the dose would be much greater than that 0.1 to 0.3. But the interesting thing about using melatonin as a tool is higher dosages do not seem to affect sleep. It almost, in some cases, they may actually cause insomnia. I mentioned melatonin with the sleep is because one of the number one issues that we find with people is a dysfunction of melatonin. When there's a dysfunction of melatonin, that leads to a number of other conditions like autoimmune conditions. It leads to things like rheumatoid arthritis. Now, the reason why I share some of this stuff is it affects a large majority of people. So if you have a client that's not responding to your exercises, you have a client that's not losing weight, these are areas where if there's a problem, their body will not respond as quickly or as fast as it should. Sleep will totally jack up a cytokine called interleukin-1 beta. And interleukin-1 beta is very, very inflammatory and negative. Think of it as a bad guy that is way stronger than testosterone and growth hormone and IGF-1 combined. So if you have this bad guy that's so powerful, that's circulating around the body, it kind of does everything you want to avoid. Makes you fatter, makes you slower, makes you dumber. So these are the things that we try to exercise or improve our nutrition to avoid. And this is where sleep could, when it's inadequate, could go counter to that. So this is a quote I saw by Dr. Cobb. I didn't give him credit here, I probably should. If you change your oil more often than you test your blood, your priorities may be out of order. It amazes me how much money people spend on maintaining their automobile, and they don't spend any money on their own health. The single best investment you can make is your health. And from a pure business perspective, let's say you made $100,000 a year or more. It doesn't really matter the number, but let's just use 100,000 because it's simple math. If someone came to you with a business proposition, hey, give me 10,000 and I'll help you make another 100,000, most people would do that. It's a 10-to-1 return. Now when you talk to people and you say, hey, would you spend $10,000 on testing? Most people would say that's a lot of money. And they don't get the big picture. The big picture is not the expense of testing. It's the expense of staying stuck where you're at. If you actually do a return on investment or some sort of cost to benefit analysis, if you invest in your health when you're young, over your lifetime you reduce your health expenses by a factor of 10. When people come in, I ask them basic questions. Have you had vitamin mineral testing? 100% no. I see trends like if someone puts something on a web about food allergies, I have all these people come in and say, hey, I had food allergy testing done. And I'll ask them why. Because what we know about food allergies is that most of the time people don't really have food allergies. What they have are reactions to food. And they're thinking because they ate this food and had a reaction, it's the food, and they're totally ignoring the organisms in their mouth and the rest of their digestive tract. So their solution would be to avoid the food as opposed to digging deeper and seeing what's going on inside of them that's causing their body to react. Healthy people could eat the widest variety of food. So when someone tells me I'm doing this diet and I'm only eating these foods, I already know before I test them, they're going to be unhealthy. I've tested more diet book authors than any person in the world, and I mean that literally. Most of the diet book authors, I should say, have died over the years, because they had a flawed approach. And here's what happens. Someone has a health issue. They come up with a diet, and temporarily, or in an acute phase, that diet helps them deal with that health issue. But the body is dynamic. And more people are traveling, and more people are doing more different things than ever before in history. So to use the same diet all the time, when you have all these different things going on in your body, is flawed. It would be kind of like saying, I'm only going to put 2 gallons of gas in my car, my fuel tank every week, even though now you're driving more miles. It just isn't going to work. So you could see that clearly with an automobile example, but for personal health, Most people, the analogy just escapes them, mostly because they're in a reactive state. They're not planning strategically, how do I get things dialed in where I want to go? So I want to share some different things that have been done. So first, I hear a lot about, carbs bad, carbs good, fat is bad, fat is good. So there's a professor named Mark Haub. He was a professor, or is a nutrition professor at Kansas State. He wanted to make an example of just how important calories are. So he basically ate junk food. He had Twinkies, Doritos, Oreos, and other basically junk food. And he lost weight, he improved his body fat, and he improved his cholesterol parameters. So he didn't measure that much, but everything he did measure did improve. And so afterwards, it was kind of like the joke on the internet was he's a Twinkie guy, and he did the Twinkie diet. And his basic perspective is that calories matter. What I would share, the reason why I share this is because when I've talked to Daniel Amen, I've talked to lots of guys that are, let's just say, anti-carbohydrate. And when I asked them, well, you're anti-carbohydrate, but have you ever run a marathon without any carbs? Could you do it? And of course, he's not fit enough to do it, so he wouldn't know. But he can't run a marathon, and he's certainly not going to be able to run it without carbs. So the point is, there's a context. The other detail of context that Dr. Haub really didn't know about, because he would have shared it, is there's data that shows we react differently to food. So you can't tell someone this food is good or bad without first knowing what's inside their body. You need to know the microbiome, and you need to know their genetics. Otherwise, you're guessing. Well, if you're guessing, anyone can do that. You don't need to pay to guess. So the main thing I left this question, do calories matter? And the answer is sometimes they do. So sometimes, like in Dr. Haub's case, going from 2,600 calories a day to 1,800, even though he's eating an all junk food diet, he was able to make some positive changes. But one of the findings that was interesting is what is worse for you? Diet or excess fat? So let's say I have all this fat on my body, it's affecting me in a negative way. So is it better for me to do whatever I can to get rid of the fat, or is it better to eat this perfect diet? And what Dr. Haub showed is that fat is pretty damaging to us in a lot of ways. So even though no one's going to say his diet was healthy, because he was able to get rid of a metabolically damaging tissue, that it had an overall beneficial effect. We don't recommend people consume this type of diet, obviously, but it brought a lot of awareness to that. It's very difficult to say something is all good or all bad because we respond differently. What I'd like to do is, I don't know how clear that would be, so let me just kind of overview it for you. So the level of detail we now do in research is vastly superior to the research ever done before in history. So studies that were done before did not measure all the genetics. They did not measure all the organisms in someone's mouth, their digestive tract. And what this particular group did is they were able to show that because of gene interactions with organisms inside of our bodies, those two things interact with the environment that we're in and affect our response to food. So they were actually to show that for some people, eating cookies was healthier than eating fruits and vegetables. And for other people, eating fruits and vegetables was way healthier than eating cookies. Now, I want to define the context of health here. In this particular study design, they were looking at markers for glucose control. So what I would have done had I been involved in the research is I would have looked at the organisms that were discovered in the people that responded positively to cookies, and I would have looked at what do those organisms do long-term to the human body. My guess would be while there was a positive result of the organism on the the glucose response to the cookies, long-term, those organisms would be damaging because the healthiest people, healthiest by my standard, where we measure every vitamin, every mineral, every amino acid, fatty acid, every hormone, the healthiest people do respond better to fruits and vegetables. This particular group, their quantification of health was based on glucose response to food. So I just want to make sure that's clear. But it brings out some interesting facts. How many times have we had clients that say, I can't lose weight? And maybe they're eating salads. Do you know certain bacteria in our stomach, in our intestine, and in our colon, they have cellulase enzyme in them. So they take iceberg lettuce and other leafy type vegetables that supposedly have no calories, and they convert it to sugar. So this poor person that doesn't know they have the organism, they're eating salads all day long, and they're getting fatter. And you're looking at the calories, go, it doesn't make sense. How could they be getting fatter on a salad? Well, it's because they ignored the microbiome. There's other things going on inside someone's body. I've actually, I measured a physician in Austin, Texas years ago. He's a buddy of mine now. He had really high estrogen levels. And I was asked to kind of see what's going on. So we did the standard, total testosterone, free testosterone, estradiol, estrone, all these different markers, hormone markers it is. And we had his physician that was treating him put him on anastrozole, and the guy didn't respond. His estrogen levels were still high. And that's really unusual. Typically, if you put someone on anastrozole, the drug, it inhibits the activity of the aromatase enzyme. So that person converts less testosterone into estradiol. So when someone is on a drug and there's no response, that's like really like, whoa, what's going on? And I happened to be working on another case. And as I was working on this other case, I came across this organism that I'd never seen before, that we had measured in someone. And I looked up this organism, and it actually has the aromatase enzyme in the organism. So then I went back and tested this doctor at the high estrogen levels, and sure enough, he had the organism. So we learn, nutrition or gastrophysiology or gastroenterology, and whether it's different types of schools or academic programs, they don't usually teach that the environment for digestion, it's a two-way street. It doesn't go one way. So think about it. We have to produce substances in our body that get into the digestive tract. So our digestive tract, cells, they have to be healthy. They need nutrients. They need hormones from the rest of our body. When we generally think about stuff, you think about it in your blood only. You don't think about it going to other parts of your body. And so because of that misperception of what's going on inside of our bodies, a lot of times things are missed or ignored because no one took the time to think that through. So I guess the one thing I'll share about that is that nutrition, we're at the level of detail we have now, you can't just recommend a diet for someone. You're basically lying to them. Because now we know details that we never knew before in history. And the difference could be that, so an example would be, if I did a very thorough workup on someone, I might find they have a strong immunological reaction to, let's say, blueberries, strawberries, or spinach. And so for that individual, I would say there's something going on when you eat these foods. It's affecting your immune system in a negative way. So I would recommend they don't consume those foods. But if I was doing a general lecture, I might say everybody eat blueberries, strawberries, and spinach. If I was looking up someone's zip code or some other way to identify the region, I would find out if there were heavy metals or some other pesticides, organophosphate chemicals in that environment, and I might recommend people in a certain geographic region not consume certain produce products because they have chemicals in them. So a recent example, in the San Francisco area, we identified some kale that was loaded with heavy metals. So I want you to think about this. People go into a farmer's market. They're buying this organic produce. Has any farmer ever tested their produce for heavy metals, pesticides, organophosphates, PCBs, all those other chemicals we know are in the environment? I've never met a farmer that has. So somehow there's chemicals in the environment that people don't know about. So therefore, there's no way they could prevent those chemicals from getting into their own body. So I see lots of guys taking branched-chain amino acids, and I thought I would share this because it's pretty fascinating. So we all know, like leucine, right, stimulates muscle protein synthesis, and branched-chain amino acids can stimulate protein synthesis. Is that right? Is everybody cool with that? So here's a question then. What happens when a cell is full? Yeah, so when there's no more amino acids, specifically leucine, valine, isoleucine. So when the cell is full, then the transporters, the amino acid transporters on the outside of the cell membrane close. So it's like closing a door. When that transformation, it's a chemical transformation that takes place that affects the structure of the cell membrane. When that happens, that person becomes insulin resistant. So where does excess energy go at that point? Well, liver, but eventually, ultimately, it's going to be converted to fat. It's going to be stored somewhere. And that's typically not anything anyone ever thinks about. One of the questions I often ask when someone comes in, they're like, hey, I'm doing this strategy with amino acids. I usually ask them, how did you know that strategy was right for you? Typically, they read about it somewhere and they're following it. They never ever measured their own amino acids. And it's something that could prevent a lot of downtime or going down the wrong path, if you will. Now, one of the things I get asked a lot about is fasting, specifically intermittent fasting. When I've actually tested people that claim they were intermittent fasting, 100% were doing something else they didn't disclose to their friends. Taking steroids, taking some fat loss drug or something. But one of the things that did occur to me is why fasting could appear like almost like a miracle pill for some people. Imagine if you don't know what your body needs. So you're eating a food. And if you had a reaction to that food, simply by eliminating that food, you would feel better. Imagine if you have too much, like I've tested a bunch of paleo diet book authors. All of them were extremely unhealthy because they had such a limited food supply in their diet. The healthiest people have the widest variety of food in their diet. It's very clear. So when I talk with people and they're eating like 7 foods or 12 foods, I already know there's not enough variety in their diet to give them the micronutrients they need to fulfill the biochemical needs to drive whatever reactions are going in their body. And I would speculate that when people have overdone something, then intermittent fasting may be a way for them to reduce the influx of amino acids or some other substance they just don't need anymore. So as a result, they may see a better response. So if we know, for example, excess branched-chain amino acids will make you fatter, then if someone stops taking branching amino acids throughout, let's say, the day or multiple days in a row, then what that allows the intracellular levels of the amino acids to go down, and then they would respond better. So this is where we start to see there's some possibilities how certain things may work for certain people. But it raises the issue then, what are they doing wrong over here that they're not aware of that they can improve upon later on? One of the biggest concerns with intermittent fasting right now is the long-term lack of micronutrients. It would be tempting to say I'll take one pill that gives me everything I need, but it's one time point. And the way things tend to work is if we take too much of given nutrients at a time, the body has different mechanisms at play that eliminate excess. And so now we eliminate the excess at this moment, but now 2 or 3 o'clock in the morning when we're sleeping and we need it, it's simply not there because we've already eliminated it. So from a practical perspective, we often recommend people take small amounts, frequent times throughout the day. But I could tell you from a patient compliant perspective, some of the most successful clients I work with, getting them to take any supplements at all, even once a day, is a challenge. So then we have to alter our approach to fit the lifestyle or the behavior of the individual. So even though we know it's not ideal, it's a better fit for compliance. So microbiome, I recently was able to do some just really cool stuff. I tested a bunch of people. I tested every organism discovered by mankind in the mouth and in the digestive tract. Every DNA type of test, every type of microbiology type of test. And I was able to figure out from doing all this analysis what really matters to help people actually improve their health. Now, why do I care about that? Why should you care about that? I'll give you some real statistics that are very important for everyone to know. The United States has 4% of the world's population. Despite having such a small amount of the world's population, we consume about 70% of the prescription drug supply. So we're roughly 15 to 20 times greater on a drug intake side than any country in the world. So we consume an excess of drugs. When we look at the #1 prescribed medication, anyone want to guess what that is? No, not insulin. No, not statins. No, not antibiotics. It's Synthroid, thyroid medication. #1 medication globally and certainly in the United States. Now here's the really ironic thing. Most of those people that are on it don't show tremendous improvement in their health. Their thyroid or TSH or some other marker may be managed, but you don't see a functional, like they're not faster or stronger or more flexible. Like there's not a measure that you could say, wow, they look so much better. What's been known since the 1930s is that bacteria in the mouth affect our predisposition for all kinds of cardiovascular disease. Now think about the legality of issues in the United States. What doctor would you expect to test bacteria in your mouth? Most people would say a dentist, right? I think that would be a reasonable assumption. Now you would say, what dentist tests for bacteria in the mouth? I've never met any. Now the significance of that is that because the bacteria in the mouth affect heart disease, you would say, well, it's heart disease, cardiologists should be testing for that. I've never found a cardiologist testing for these organisms. Now remember what I said, this has been known since the 30s. This is not like, hey, brand new discovery. So now let's fast forward to more modern analytical methods, and what we now know is that if we kill off the organisms in the mouth, people's blood pressure normalizes, their heart function improves. And now here's where it gets really alarming. We're talking about people never needing medications again from a treatment that's maybe $12 a month. And by the way, their breath smells better, they no longer have any autoimmune conditions, their joint pain goes away, $12 a month. Now, when this is extremely disruptive right now because there is tremendous money. In a world of cardiovascular medicine, they're screening, you may have seen it like Lifeline and some of these other big mobile buses come up and they run all these tests on you. And they do it at a very good price point. They may do $1,000 worth of testing for anywhere from $29 to $49, depending on the market in the United States. The reason why they do that is because one of those cases is going to lead to 100 grand or more revenue. So what we now know is those cases that would have been, insurance would have been 100 grand, that could have been prevented for maybe $12 a month. So what we're seeing right now is that there's just such a disconnect of measurement of accurate data and getting it to the people that could actually benefit from it. Now, why does that matter? So the organisms in your mouth, #1 impact for autoimmune diseases. How many people have met someone with an autoimmune condition? They're now linking some of these bacteria to things like ADD, ADHD, autism, Parkinson's, and so forth. The reason why you're going to see lots of data coming out saying these bacteria, we're talking only 11. That's all it is. Those 11 bacteria are linked to all these other conditions because they're highly inflammatory. See, they were originally discovered when someone had like a periodontal disease or gingivitis. So now what happens is when you go for a checkup to a dentist, they go, oh, you don't have periodontal disease, you don't have any gingivitis, so there's no concern about bacteria, but you can't see them. It's not like they're waving at you or something. So because you can't see it, they're ignored and overlooked. And what we now know is they're affecting. So I'll share with you 100% of the people we tested had 8 or more of the 11 bacteria that are known to cause all these diseases. So myself included, I think I had like 8. And so the thing you got to keep in mind, so let's say a guy has it. That guy kisses his wife or his partner. She kisses her kids. Everybody has it. So when we test the whole household, we find everybody has it. You don't have to, it doesn't have to be like a very intimate kiss. It can be a superficial kiss, and the organisms can spread and grow. Some of these organisms, they think now can even spread, these are bacteria in the mouth we're talking about, but they could spread by casual contact to the hand, especially with children. Because, they don't, they're always kind of playing with everything and never really thinking about washing their hands and putting their hands in the mouth. So I share this stuff because right now we're able to work out a deal where we can make available what used to be $2,200 worth of testing available for $200 or $220, sorry. This is for Saturday and Sunday only. So these are now things that people can get done at a very low price point and actually see what's going on. The impact it has, people that have had joint pain, people have had high blood pressure issues. As we do this stuff with them, we just see those things disappear over time. So they no longer need their meds. So you're starting to understand why we changed our company name from Human Performance Specialist to Causenta, because we're actually measuring genetics, we're measuring microorganisms, and all these other details that are allowing us to permanently erase disease from the future of our clients. This is a mindset thing. When I talk to professors, I was on a board meeting. I was talking with doctors from Mayo Clinic. I was talking with some billionaires and some business guys and some scientists from NASA. And one of the things that really, really disappointed me, you have all this money, all this intellect, and all everyone talked about was how they were going to make money. No one ever talked about how are we going to solve this problem, how are we going to cure this disease, how are we going to erase it from the future of mankind. So think about this, president of a company, if he says the mandate for our group, we're going to make money, how is anyone going to cure anything? No one's ever been dedicated with that task, right? You can't accomplish a goal that you haven't even set. And now you look at the facade of cancer centers. Billions of dollars raised at all these cancer centers, yet so little progress given the amount of time and money they had. And so what you're starting to see now is you're going to start seeing all these big groups saying, we're going to cure cancer in X years, et cetera. You could prevent people from ever getting cancer right now. You don't need lots of money and time. You just need attention to detail. And I'll go over some of that stuff in a little bit. But what I want you guys to kind of get is we're way past sets and reps. We're way past, I'm going to do 5 sprints. We have a level of detail now that we can measure things in the body that can literally determine if you die at 45 or you die at 80. That's the level of detail that we have. So on the genomic side, I was trying to think, I literally just got the results of my genetic testing last night. I was on the phone with an MD PhD from Harvard and from Stanford and this geeky guy from MIT, really smart guys. They knew every little detail about every gene in the body, which was fascinating how much detail these people knew. What disappointed me though was their solution for everything was a drug. And it just shows you just how ingrained everything is in our medical model. So when I asked them, well, what about exercise? What about improving sleep? What about nutrition? The response was, well, there's no data on that. So I said, well, have you looked? Because when I studied your algorithm, I don't see in your algorithm where you factored exercise, nutrition, and sleep, which we already know is critical for fighting disease, yet you're not even looking at that. And they're basically, what I see is most of the larger institutions, they're focusing on collecting genetic data with the long-term goal of selling that genetic data to drug companies to make more drugs and to insurance companies so insurance companies can charge everyone more money based on their genetics. So think about this, major medical centers doing all this cool data and collection, but nowhere is there the goal to solve the problem permanently. The goal is to sell the data to make more money. So that explains why so little results are taking place at so many of these research centers. You don't have the brightest minds focused on a task, let's solve this problem. You have them misdirected. We're going to take this genius here, and we're going to have them try to make a new drug that we can have someone take the rest of their life. That's where our intellectual resources are going right now. So on cancer, I wanted to share some really fascinating things, and it's also quite shocking. So right now, there's about 25 cancers we could test at a level of detail. The proteins that we measure or that can be measured are called ENOX2 proteins. They are extremely specific. They can only be produced from cancer cells. So if you have it, you have cancer. There's no maybe or perhaps, you definitely have it. You could measure these proteins when there's only 2 million cells present. Now 2 million cells sounds like a lot, but to put it in perspective, 2 million cells would not show up on a CT scan or MRI. So they're basically, it's invisible. So if you got scanned, you would say negative, there would find to be no signs of any tumor mass or something along those lines. When you're measuring this here, because it's so small in terms of gross size, it has not had a chance to affect the individual in a measurable way that we know of right now. So basically, this person has cancer, but they're still healthy. we could treat those 25 cancers. There are different combinations of natural substances, but two that are getting a tremendous amount of attention. Capsaicin, which is red pepper, which you could buy it at in any supermarket, like the red pepper flakes, that kind of stuff. And green tea, which is cheap as hell. And if we were to factor in the cost of testing, the cost of treatment, and the cost of retesting to make sure the cancer's all gone over a 3-year period, the total expense is about $6,000. So think about this, $6,000 to find something and eliminate it from your body. The sad part, not a single major cancer center is doing this right now. Why? Because they're gonna make way more money than this. These technologies are disruptive. You're going to see a lot of controversy. You're going to hear doctors that are sponsored by drug companies say, well, there's not enough research. Because we're talking about with this strategy, no need for radiation therapy, no need for chemotherapy, no need for surgery. So now what are those, the people that practice in that area, what would they do if overnight that's not necessary? They're displaced high-income workers, basically. So I share this because I hear people tell me all the time, well, there's no cure, there's no cure. Well, I don't know that I would say there's a cure for anything, but what I would say is I can produce a result that my clients are happy with. I'm very confident in saying that. And one of the biggest fears in society in the United States, #1 disease is cancer. The main reason why people fear cancer the most is they know so little about it, because the oncology team working with them does such little work to see what's going on. So right now, United States, before you walk into a cancer treatment center, they already have the treatment for you. They don't know your name, but they know how they're gonna fix you. Does that make any sense to anyone? Would you ever tell your client, I have a sprint program, but you don't even know if they could walk right? Would you have me on a sprint program when I can't walk right? I have all this osteoarthritis issues, I have bone spurs in my hips. You need to know details about someone before you figure out what you're gonna do with them. You don't have it without ever seeing them, right? That's illogical, and we know it doesn't work already. So I share this because right now, in the United States alone, it's not globally, just the United States, 100,000 to 1 million people are gonna die every year simply because they did not get the right treatment. So it's not that there wasn't a treatment to help them. It's that they went into a center and they got some drugs, and no one took the time to do genetic sequencing, no one took the time to see certain nutrients in their blood if that would interfere or enhance the results of certain chemotherapy drugs. And I was sharing with John outside earlier, bacterial infections are life-threatening to a cancer patient undergoing chemo because the bacteria produce chemicals that make the cancer cells resistant to chemotherapy. And this is well established. This isn't like cutting edge, I'm the only guy that knows. This is like lots of research is out there. Now you go to the oncology centers knowing this and you say, why aren't you doing anything? It's because of time. The doctors do not have enough time to stay up to date. They learned what they learned in medical school, and they're being misdirected by drug companies to study in a certain area. So, all right, so I know I bounced around from sleep to nutrition and stuff. I wanted to share with, one other thing I don't think I mentioned on a genetic side. So I talked with the guys from a group that do the 22,000 genes. And so, I'm going out to do this presentation. Most people aren't going to have 10 grand and just drop off the top, for some testing. They're going to offer, assuming we get enough people that do it, all 22,000 genes for $5,000. Now I know $5,000 is a lot of money, but at a cost per test of like 25 cents or less, you are never going to get that much volume of testing done. You can't go into LabCorp Quest or any lab test now and get that much information for such a low rate. So I just wanted to make sure everyone heard about that. And then going forward, I have an interesting story to share. So I was looking at all these testosterone products in the market, particularly at GNC. Average testosterone product, how much does it cost to make? Anyone want to venture a guess? What were the numbers? Yep, $3 to $5. Most of the testosterone boosting products in the market, the label and the packaging costs more than the material inside. And so typically it's something like $3 to make, and that's packaging included. And then they're going to put this, ridiculous price, like $129.95 or $89.95, and they're going to draw a line through it and sell it for whatever they sell it for. So I shared out because the large chains, your GNCs, your Vitamin Shops, your Vitamin Worlds, your High Health, all these other institutions, they require the manufacturers of these products to spend significant money in advertising. So most of that margin is simply geared towards marketing and advertising. So I've been involved. I was one of the first scientists in the United States, well, the only scientist that took all these different herbs and isolated all the different bioactive constituents, dose response tested them, and then recombined them to figure out how to increase testosterone the most. Since I did that research, a lot of that dates back to late 90s and early like 2002. A number of other research groups have come out with all kinds of ways to naturally increase testosterone. So I thought all these companies are competing against each other to basically say to have the best ingredient that raises testosterone. So I decided I was going to try to do something never ever done before in history. I contacted all these companies that have patents on these individual ingredients that are basically competing against each other. And I said, I want to basically license your patented ingredient from all of you companies. I want to put them in one product. So essentially the goal, and I worked on this goal with a team of scientists, is this was the mandate. The best testosterone product in history of mankind, no exception. And that if you are personally sitting across the table with your closest friend, you could look your friend in the eye and say, this is the best product ever produced in that market, raising testosterone. And so I got all these guys working together. And the reason why I share this is I'm going to be able to do this in a lot of other areas, particularly in fighting disease. But nowhere before have you had now bright minds coming together with a common goal and the level of detail that we have. So what I want to share with you, this is one ingredient. We have a lot of ingredients and they all work and they all have the exact dose, the exact chemical structure, the exact chemical form, the matrix, everything's exactly the same as in the studies that were done on the ingredient. This one ingredient, more commonly referred to as ashwagandha, this increases bench press 1 RM. So the group taking the supplement, their bench press 1 RM went up 92 pounds roughly, say 46 kilos, versus the group taking a placebo went up only 26 kilograms. So we'll just say double it times 2.2 or something. The group getting this single supplement, their total testosterone went from 630 to 727. The placebo group was 675 to 693. So the one group had an increase in testosterone of 96, the other group 18. So basically what I wanted you to see, increased muscle, increased strength, more increased strength in lower body. One thing I will point out, the actual study, I have the link at the bottom of the slide, so you can read it for yourself. These were guys that did not have, these were beginners, if you will. They weren't strength trained professionals or guys that have been competing. Typically in research, we would say 2 or 3 years at a minimum, because we want to really see, is this ingredient helping the more advanced people out there? Lots of companies will do stuff with beginners because they know they're going to respond. But what was interesting is both groups had beginners, and they both, even though the placebo group responded well, the treatment group responded much better. Here's a second ingredient. There's a product called Shilajit, which not too many people usually know about. Basically, if you notice, they took 250 milligrams twice a day for 90 days, a significant increase in total testosterone. When I use TT in my slides, it's just total testosterone, free testosterone, and DHA sulfate. Now, a lot of these studies, they're done on men simply because they're the concern of if a female was pregnant and no one knew, would there be any harm, to the baby or the fetus inside? So that's for safety reasons. They don't always do them on women. But in terms of the mechanism of action, a lot of these particular products affect at the hypothalamus and pituitary. So you would expect if you're affecting the brain, there's going to be a downstream effect. It would improve hormone levels in men and women. Then lastly, what I want to share with you guys is I get questions all the time, how do we stay up to date? How do we know all this stuff? And let me just be very direct. There's no way I could take, on a given day, we may have data from, 1,000 people or more coming in. We measure sometimes 100,000 markers on some people. And we've done this now, for almost 30 years. There's no way I could take all this information from all these bright people and just teach it to someone, in a day, a weekend. It's too complex, and there's too many variables that we still don't fully understand. The one basic thing I would say about nutrition, for example, no one knows anything yet, because the more we learn, the more we realize, wow, that's another area we never ever considered before in history. I'm not talking like in a week, I mean all of mankind, we never thought about this before. So what I started deciding to do is to leverage the volume of information and make sure more people have access to it. We're going to create a membership site. And what's really cool is, I left out a story, sorry. So when I was trying to research this ingredient for raising testosterone, I contacted this research group in India. And the group in India refers me to a research group in New York. And the group in New York refers me to a group in California. And the group in California refers me to a guy in Colorado. The guy they referred me to in Colorado is a guy I went to school with. So the joke, I was like, dude, I gotta fucking call India just to get in touch with you. Why don't you call me back? So the point is that that guy, by the way, has got a TV show on one of the Discovery programs. He's a biomechanist, but when I was a student in school, you were basically told to do whatever your director told you to do. So my passion was more nutritional biochemistry. His passion was more biomechanics. But I've done lots of biomechanics studies. We've wired people up. We've measured flexion, extension, and all kinds of movements in various joints. We've measured all kinds of stuff in the brain and the heart, other parts of the body. But it just wasn't my passion. It was because I was a body and I had to do what I was told. So I'm going to start bringing in some really cool technologies, and we're going to be collecting all kinds of data in real time. So most of you don't know that much about the center I created. I custom designed all of the strength equipment that we have. Essentially, I hired Samson Strength Equipment. I talked with their engineers, and I said, look, I want to move some of the stuff around because I think you guys got it backwards. And we have, like cable pulley machines that go up to 500 pounds. Most people, won't lift 500 pounds on a pulley. But I was setting the stage so long term, I can now add force platforms. I can now measure brain activity. I can measure heart activity. I can measure muscle activity. I can do nerve conduction velocity studies. I can measure all this data in real time. And then basically what we're going toward is to come up with a model that in real time, we can measure someone and tell them what to do that will improve their life on the spot. Eventually, a lot of blood testing that's popular now, it's not going to be useful anymore because we'll be able to take our cell phone and just use the light and measure these markers through our skin, just like pulse oximetry does right now. So that was the story I forgot to tell you. So now getting back to this, I've worked with thousands of athletes over the years. Over there you see Ray Lewis and Donovan Mcnabb. Donovan was at my kitchen laboratory before John, just so that we... So funny story about Donovan, I got a knock on the door one morning, and I answered the door, and he goes, hey, I have to go and catch a plane. Can you draw my blood and run some tests? So imagine the mindset of these guys. No, I don't know he's showing up. I'm not prepared in any way, but somehow I have to figure out what to do in order to help him. So that's most of my experience has been working with a lot of these athletes. I worked with, what's funny, I didn't intend this, but Ray and Bill Romanowski, I worked with both of those guys for a long time. And one of the interesting things, there were two athletes that had some of the longest careers in NFL. Those guys had the largest supplement packs. Literally, we had them on so many things that the packs were almost bursting. At one point, I think we had them on over 200 pills in a meal. And that's not something we would recommend everyone do. But what would happen is we would test these guys, and we would say, you need, say, 20 pills. And then they would say, oh, what about this? What about that? What about this? And as their performance would improve, they would want more pills. And their performance gets better. They want more pills. So scientifically, it's hard to justify some of this stuff. But from a practical perspective, if you're working with a client and it doesn't matter the strategy. If they continue to get better, you lose then the justification to stop what you're doing because they're getting better. So even when we had science, we didn't always use it, was my point. So anyway, I've had a lot of fun with these guys, and so I want to start sharing a lot of this information. So on the next slide, I know people have different budgets and stuff, but what I wanted to communicate is we'll have different programs that you could do monthly. You can cancel any time. I don't believe in signing people to contracts or anything like that. But what we're trying to do right now is we're trying to raise about $150,000. And with that $150,000, we're going to do some really amazing stuff. So what I have as an incentive for people is rather than doing monthly, if they do a year in advance, basically they get 2 months free. And then when the new Renew Mail product comes out, they basically will get 1, 2, or 3 bottles free. So it's something that probably more attractive to guys as far as Renew Mail. I can tell you that the female athletes we have taken the Renew Mail products do very well. A lot of my female clients, I'll see people often accuse them of being on steroids. Not one of my clients that's competing is on any banned substances. I'm very proud of that. And I've been doing this since 1989. I've never had a single athlete test positive for any banned substances, and I've worked with a large number of world champions and world record holders and stuff like that. The website domain, you could tell how much I suck at marketing. I don't even tell you where to go. The website domain, let's see, here it is. It's just causenta.com and then /PALP for Power Athlete landing page. And so what I want to do is give people an opportunity to get involved with something at an early stage that if you take advantage of it, I think you're going to be really happy with the quality of information that you get. So let's see, we've got about half an hour or so, is that correct?
Yeah. I mean, we're just going to honestly go till these guys kick us out,
Okay,
or you guys want to leave.
So I try to pick topics that I thought, when I looked at all of the research as a whole, given the things that we measure on people, that could have the most impact. So I hope that everyone found it was helpful and useful. But in the event that I didn't maybe talk about something or touch upon something that was of personal interest, I'm more than happy to answer any questions about any other areas, if anyone has any questions. Sure.
The slide you were talking about with the organisms in the mouth and with the thyroid issue. Once you start cleaning up those organisms, does the thyroid issue start going away, or?
Yeah. So so assuming that was the primary driving factor.
Well, here I can be a little more specific. My wife was diagnosed with Hashimoto's.
Sure.
Would that be part of the cause? And she's just started she's been trying to stay away from the medicines and all that stuff, trying to clean it up with the diet. Would help with the biomes help with that, or is there more to it?
So potentially organisms in the mouth and in the rest of the digestive tract could be affecting the body's immune system reaction, and it could target the thyroid gland. A more complete analysis, though, my recommendation would be, so based on someone's ancestry genetics, there are certain people with a Northern European ancestry, they clearly have reaction to wheat, and the wheat could be a trigger, so it's kind of like recipe, So you have these organisms here, you have some genetic component here, based on where someone comes from. And this ancestry gene, by the way, most people don't know it. So for example, I know I'm slightly off topic, but I tested every gene in my body. So I was always told I'm Irish, English, Italian, and Polish. In my 40s, I found out I'm not Polish, I'm Austrian. So even though my whole family speaks Polish. And then when I did my genetic testing, I find out I'm French and Russian. So, yeah, I know. Well, I knew I was a mutt going into it. But the point is, nowhere in my family history did anyone ever say French or Russian. So when you do the genetics, who knows how far back someone moved from one part of the globe to another part. So getting back, to your wife's case, she may have this ancestral DNA that she just doesn't know about because I didn't know any of my ancestral DNA. So it's always a possibility. But in terms of, factors that modulate immune reaction to different challenges, Vitamins and minerals are really critical to that. There's tons of data showing that to test food allergies first is not the best option for people because the reaction of the lymphocytes to food is determined by their status of like zinc, selenium, vitamin A, vitamin D. So, in terms of like solving someone's thyroid issues, one would measure every thyroid hormone, let's say do a full axis. We look at historically what's happened over time. Was there like a really good workup, and was there a proper diagnosis from that workup? A lot of times we have people come in, they're told they have a thyroid issue, and I don't see any evidence of a thyroid issue. I do find other problems though that we will target. So we do a full thyroid workup, we do vitamin mineral testing, and then some organisms. And what we would do first, we would tell someone, here's everything we recommend. We never put anyone in any pressure. They are free to say thank you and walk away. They're free to move forward. But we also try to find out, given their insurance, what's covered, what's not covered. So before they ever get like an expense outside the initial consultation fee with a physician, they at least know what they're going to be faced with up front, because many times going through insurance is not cheaper. We know, for example, when we could do some hormone tests, 30 to 40 bucks. And the lab will whack someone's insurance 300 bucks. So the lab is whacking insurance 10 times more than the cash prices. So now if your insurance covers 50%, you're still paying more. Even 80% sometimes is more than the cash price. So you want to know that before you commit your money and resources, not after. Because the crazy thing is legally, once you go through the insurance, you can't reverse it when they don't cover it. The law says you're obligated to pay it as a patient. So I hope that answered your question in detail.
One other quick, well, it might not be quick, but you're talking about blood testing and stuff. What type of blood testing, do you do as far as, like, I've never really had my blood tested. So what would be, where do you start and,
Yeah, so first we would start with we would do what's, we refer to as an initial intake, but it could be like a consult. You just have a conversation. And we kind of review what's important to you, review your background with detail, like family issues, any problems you may have had as a kid. One of the big challenges, many times people just don't remember. So as an example, someone said to me, you have an ankle issue, I have any ankle problems? I said, no, I never did, because I didn't remember. Then all of a sudden I'm doing this exercise, I remember, wait a minute, when I was 9, I tore up my ankle. On the spot, you can't remember your entire life history. So information tends to come out the more you interact with someone. And as you start creating a timeline, you start to see that there's some possible vectors or causes or sources of some of the issues people have. Many times people would say, I would say, do you ever have an infection? They would say no. And as we start talking through them, we wind up finding they got sick at one point, and at some time point after, that's when their health issues started later on. But it wasn't as obvious to them because they're busy and living their life. They're not writing every little detail down in a chronological way where it makes sense. And then from there, we would say, here's what we recommend, and then you would make a decision if you want to do it or not. So there's no salesperson going to call you everything. Someone else? Oh.
Sheer laziness, sorry.
That's efficient energy expenditure.
Going on with some of the nutritional stuff, what's your take on ketosis and ketogenic diets and where that is going, especially even in like the medical world, not just sports?
Yeah, so it's just a strategy. There's no single strategy that works 100% of the time. What's happening right now is they're just doing a circle. So 1800s, ketogenic diets were popular. Phases out, Atkins brings it back in, phases out. Dr. Finney probably most recently led that. Dr. Finney's an MD PhD at UC Davis has kind of started a lot more to ketogenic research. One of my buddies from school, Jeff Volek, has now published a book with Dr. Finney. I got all kinds of funny stories about us and Dr. Finney and Jeff years ago, but it's a strategy. Proponents of the ketogenic diet often take things out of context. So for an example, some cancers, if you put someone like a brain cancer, put someone on a ketogenic diet, there may be a beneficial outcome. But simultaneously, while you're looking at the cancer in the brain, you're screwing up the gut in that person because high levels of fat alter the microbiome in a way that long-term increases the risk for cancer. So while ketogenic diets would be one strategy, what I would look at is other strategies as well, and I would make a decision based on overall assessment of the individual and see what's going on. I've yet to see long term, like you would argue, if someone has an unfavorable profile in their microbiome, their glucose levels will run high. So you could do a ketogenic diet for that person, lower their blood glucose levels, and as a result, you starve the cancer cells, and now the cancer in the brain would go down. But you would then say, well, if you tested them appropriately, why not just fix the bacteria in their gut that are putting them in that direction? But if we're focusing on glucose management, there are far better methods than ketogenic diets for stabilizing blood glucose. The gold standard right now would be alpha-lipoic acid with Garcinia cambogia, hydroxycitric acid, with naltrexone. That cocktail is 100% effective for getting rid of glucose in cancer cells. Basically what you're doing is you metabolically starve the cancer and you simultaneously increase natural killer cell function at the same time. And one of the dangers with the ketogenic diets, and I'm not like for or against them, by the way, it's a tool. One of the challenges with ketogenic diets is they weaken natural killer cell function. So if someone has cancer and your goal is to make them cancer-free for life, you got to think beyond like 90 days or the short-term trials that are done. You got to look at what's going on in the future,
Two questions. What do you do to address cortisol levels and adrenal levels? Just seeing that a lot in athletes of where would you head initially for that, especially with moving targets, because whether it's morning cortisol levels or afternoon cortisol levels.
So how are they measured in saliva or urine, or how are you interpreting that they have high cortisol levels or low? Like, is it high or low cortisol, and how are you measuring it?
Just in general, not a specific case of whether or not they have high or low, of just seeing quote unquote adrenal fatigue out there and athletes that basically, going back to the point that you talked about before of, hey, every athlete that I talked to was overtrained.
Sure. So I'll share with you a story that I think will directly answer. So I've had world record holders come in to my facility, and because of my background lifting years ago, their expectation is I'm going to show them some magical way to train and they're going to get stronger. And when I would assess them, the first thing I would see is how tight they are. They're basically walking around like this. That tightness is a constant threat to the nervous system. That will raise cortisol. So the easiest way, or the easiest way for most of us to lower cortisol in someone is reduce the perceived threat. So if someone is tight, there is a perceived threat. That threat could be from pain. So like if I have pain in my hip, the pain will send signals to the nervous system that initiates what scientists would collectively refer to as a startle reflex. So imagine a low-level startle reflex. That's just like a little tightness that most people you see in their traps. What's ignored, by the way, is the tightness around the hips. Many people are extremely tight around the hips, and there's no awareness because they don't even know. They can feel their shoulders going up and down. So I would teach relaxation drills first. I used to be into meditation yoga. Then I realized one day, it's 1,000 years old, and I know more now than they did 1,000 years ago. So I no longer do meditation or yoga. We do way more advanced stuff. We bring in principles of neurology. So we're now doing yoga 2.0, if you will. Because it doesn't make any sense to not take advantage of what science has taught us. So I'm not saying yoga is bad. I'm just saying we've evolved. So in the case of like an athlete, I would first see, do they know how to relax? My chances are they don't. If they can't relax, they're never really going to be as strong or as fast as they want to be, because a tight muscle does not move as quickly or as powerfully as a more supple muscle. Then another thing would be maybe breathing techniques. I've helped many world record holders set world records teaching them how to breathe. So as a real simple example, we can do this real time. So right now, everybody's sitting where they are. So if I tell you, try to breathe in just in the left side of your body, could you make that side expand and not the other side? Most people couldn't, because they lack internal body awareness. So if you can't do something simple like breathing, how are you going to do some more complicated movement patterns for a sport? So what happens then is people compensate. But biomechanically, we could help everyone do it. You just flex. Now take a deep breath in, and if one side expands more. So we could use biomechanics to help us improve our understanding of neurology. So now we can help teach people that's what that feels like. And then over time, we can get them more cued into movement in that part of their body that they were not able to move well before. It's a simple example, but it could be done with anything. It could be done with, so the way we normally would start, we do a lot of stuff with shoulder circles, hip circles, and ankle circles. And one of the reasons is there's these concepts in neurology called mirroring. So I have left hip pain. So I could take a simple stance forward, extend the opposite shoulder, and then just do some circles. And these are the techniques that help the body get out of pain. I never learned, I have 23 years of college, I've taken all kinds of neurology courses. I never learned that. Not a single doctor told me this. And then one day I'm talking with this guy, I'm like, what the hell is that hokey shit you're doing, man? He's like, oh, it helps me get out of pain. I'm like, get out of pain? What do you mean? And so he tells me this stuff, and I never heard of it. I literally never heard of it. I started researching it, and I started looking at the neural pathways from the brain all the way down, and he was right. Then I came across some really well-written articles on Scientific American website on pain, and it totally changed my perspective. And for example, what you typically hear, you get hurt. You go get an MRI, and the doctor, the radiologist says, this is jacked up, this is torn. And what everybody does is they explain the story is based on the damage they see. 100% wrong, 100%. Why do we say that? Because when we MRI 1,000 people, so this has been done over and over again in every major sport. So the classic model is professional baseball pitchers. So you do an MRI of both shoulders. And so they have all this MRI data, very detailed. They have radiologists look at the shoulders of the pitchers. Then they interview the pitchers, and they go, do you have pain? Do you not have pain? And the guys that say, no, coach, doc, my shoulder feels great, those guys have the worst damage. The guys that have the most pain have the least damage. And we know this from other areas like phantom pain. How does someone have a pain in a limb that's not there? So what happens is we are visually biased. So we explain our stories based on what we see and know. But everything else in the body was still happening. It wasn't like, when we did a study years ago, we did a study on resistance training affecting testosterone. We didn't measure anything in the nervous system at the time. Years later, we did the same study, and we found all the stuff happening in the nervous system simultaneously. So think about all the systems in the body, all the cells. Whenever something is done, somehow every cell in the body knows what's going on. And we're just now starting to understand the different ways that the cells in the body communicate. And by the way, does anyone know what that's called? Physiological crosstalk, which is the name of my new membership that I have. So I have all the intellectual property rights on that because that is the future that everything is going in. It's no longer going to be like sets and reps. So for example, fastest way to make someone superhuman strong, teach them how to develop internal tension. And now it makes sense. How are these skinny guys freakishly strong and they never lift weights, but they did, dynamic tension or some isometric stuff. And now these huge guys here over strong. The common denominator is they know how to develop internal tension. How many people were taught that or practiced that? I never was taught that, and I got tons of physiology courses and stuff. This is things that it's just taken time to put together. So I hope I wasn't too long-winded.
Next question. Selfishly, what would you do for disc injuries, specifically for myself, a degenerated disc of what sort of witchcraft do you have for that?
I'd say, come on up. Let's find out. Let me just, my lips are parched. Let me get some water. Yeah. So, all right, so I'm going to challenge a lot of the perspectives and philosophies. And one of the things I wanted to just say is, first, what's your name? Ian. Ian, Tom. So I work with lots of professionals, and sometimes, when you're talking, you're having fun, I'm not the type of person that wants to put down another professional, so I like to be positive energy, So I know we all have bias, like if we're educated a certain way by our program, et cetera, that's tend to be how we think. But what's happening now is information is coming out so rapidly basically what I'm telling you is everything I learned in college and school was wrong. I now learn all this new stuff that makes all those great professors, they just didn't know it. It was the best they knew at the time. So as we move forward, we're just gonna learn more stuff. There's nothing wrong with that. That's the whole idea of science. We're gonna keep marching forward. So first, let's just see, can you touch the ground or like where you have tightness?
Like lumbar flexion here, or even extension.
Okay. So where would you feel pain the most? Or where'd you feel a sensation, maybe not pain? Okay. All right. So what would you normally do to get out of pain?
Move.
Okay.
That's so if I'm standing, then I'm gonna move either to seated or kind of shift weight hip to hip. I can't stand statically
Okay.
in the same position, so I find my way out of it by moving.
Okay. All right. Could everyone see, could you maybe stand in front of everyone and just show people what your movement looks like when you touch the ground? Yeah, so why don't you go down slower and just kind of say when you feel a sensation maybe.
I feel tightness in the hamstrings.
Well, I meant the back. So like if you feel anything that's discomfort or pain, when would you feel it? Like how far down?
I would say it starts mainly here.
Okay, that's good for now. So what I want people to understand is in terms of internal body awareness, you have to know where it starts. Because if I do something, how would you know if it improved, right? You need an objective measure. So we would call this as a test and a retest, basically. So you, for yourself, doesn't matter what I think, what I know, you have to know for yourself if what I'm going to suggest helps you. So you need to know where it starts, and then as you go down towards the ground, does the pain get worse, does the dysfunction get worse, or does it stay the same?
I would say it generally gets worse, but more so than range would be duration. So that's kind of like the idea of static. If I just sat here for a while, it would get me the most.
All right. So first we'll start with some basic concepts on mirroring. So the mirror joint for the lumbar region would be the cervical region. So the first thing I want you to do is imagine, if you will, nice, do you mind if I touch you? You're just very muscular. I like you, man. I just want to make sure you're okay with that. So I want you to think a nice tall spine. So imagine, if you will, there's like a string coming from your head and it's kind of pulling you up, and just kind of relax into it a little bit. Now what I want you to try to do is keep your body. So does everyone notice his hand position? So does everyone know what that pattern is referred to, by the way? So yeah, well, let me do this. Before we get started, how about you just walk? Just walk back and forth in front of everyone. Yeah. Yeah. So what I want you to do is look at his hands, look at his feet. Then as he's doing that, and I'm not criticizing or anything, I just wanted people to see like a real example. As he's walking, tell me what you observe. Now, one of the easiest ways to observe patterns in people is something called dead space. So imagine if you're trying to look at my elbows and my shoulders and my hips. That's really hard to do. But if he was walking, go down that way, please, a little bit. I could look through him at the dead space to his arms, to his sides. So it's easier for me to see then if one side is off more than the other, as opposed to his hand, his wrist, his elbow, and his shoulder. Okay? So when you walk, where should your hands be? Like generally speaking? Yeah, what I mean, where should your palm? Maybe I asked it the wrong way. Where'd your palms be?
I guess neutral?
Yeah, there should be, well, basically, if you had your hand extended, it should be perfectly flat, right? So as you walk, do you find that your hand is internally rotating more?
Especially on the left side of my entire shoulder on the left side, that I feel very kyphotic. On this side, I've rolled forward in like this lat and straight. It doesn't seem to engage much. Sometimes it does feel like it's fine, but if you ask me right now, this shoulder feels like it's rolled in. So this one doesn't feel as much IR as this one, which definitely feels like.
Okay, so maybe another little test, maybe face the group, and just have your arm come out here and bend it. So we do like 90-90, and just do like an internal external rotation. So find out, can you come back anymore? Okay, so that's about his motion there. Can you come forward anymore? And then do the same thing on the other side, and just want everybody to kind of look at where he's at. So just, so this would be like come down a little bit, there you go, and just kind of like rotate this way, rotate that way. And so left side's tighter than the right side? Yeah. And does everybody see that? Okay, so I want to make sure everybody has it in a sense. All right, so we're not going to touch the joints. We're just going to have us do some neck circles first. So the way a neck circle looks is you're going to just, kind of nice and relaxed and tall, and just imagine now there's a string. I'm going to go up to the ceiling, and I'm just going to start off with a very subtle circle. And as I get more comfortable, The idea is to have my head just kind of flop around in a controlled way. And I think about this ear is going to touch this shoulder, this chin is going to touch your chest, the back of your head touches the back of you. Just do that. Just do it maybe like 5 times one way, gradually getting bigger and bigger circles, and 5 the other way. And while he's doing that, so does anyone know why I would recommend that? So if someone has pain in a particular joint, years ago I watched all kinds of therapists and doctors do different things I felt were really aggressive. And I've noticed the patient is getting in more pain before he gets out of pain. And I thought, well, that might work for an athlete, but if I had an elderly osteoporotic female, do you think she's going to want me to put her in any pain? So I had to start looking for ways to help people that essentially do not affect the area that is of concern to them. Because what happens once you have pain in a joint? Are you ready to jump in it, or are you always a little cautious and hesitant? Usually cautious and hesitant. Did you do some each way? All right, see now how it feels when you touch the ground. When do you feel the sensation?
I would definitely say that it's a little bit further down. Like I feel it more here than when it was higher up.
Okay.
Although when I come up all the way, that's where I can feel it in erectors of like standing here. But going down to that point, it definitely feels better than when I initially started.
Yeah.
Sorry.
So you don't have to do direct action to just reduce pain on the spot. So what happens a lot of times, because there's a lot of biomechanical bias and visual bias, we forget other parts of the nervous system. Does anyone know what the gatekeeper for like signals to the brain is, or one of the gatekeepers? Thalamus. So here's another. Do we have any tissues?
Tissue paper?
Yeah. Oh, okay, don't worry about it.
Anyone
How
have
about it?
tissue
How about
paper?
it's okay. That's a little stiff. I mean, are these used? No, I'm kidding. I got a special one for you, man. All right. So sorry, just had to let it go. So anyone know what a motor homunculus is or a sensory homunculus? So where does the brain perceive as most of the neurons? Where? Hands, and where else? Face? So anyone has pain, just knowing that principle, what could you do to help them get out of pain on the spot?
Distract.
Right. So you simply provide a stronger positive input. So let's just say, as you're going down, so I want you first, basically like a pain stroke, brush it, just kind of make like a square. Okay. So you're going to start doing that right now. Just kind of get used to it. Just know, okay, a little lighter. It's got to feel like nice and soft. Think gentle. Don't think crush.
Less sexy.
Yeah.
Less sexy.
Okay. Okay. Now, can you feel the sensation against your face and everything? Okay. Now, just stop there for a moment. Now, just go bend down and see if it feels any different. I heard you pop on the way up.
Yeah.
On the way down, how'd it feel?
On the way down, it feels good. I'm more aware now when I stand up, actually, than the first time when I went down.
So we would do, like when I have a client come in, we do techniques that essentially get their nervous system to focus on another area of their body that feels good. It has to be non-threatening. Why do we do that? Because when someone is under a state of threat, so they're worried about, let's say, back pain, are they going to move normal? Their movement's going to be altered. They're going to compensate. They're going to shift things in a way that isn't healthy. So the rules are very simple. First, get out of pain. And next, 1 pain-free rep. So all I need is 1 rep. And that rep doesn't have to be all the way down. If I can go here pain-free, it's a great place to start. And now we start working on the range of motion. We stay pain-free. And why is that? Because we know if we have pain-free movement, we have better quality movement. With better quality movement, we could remodel tissue in a healthy way. If we have altered movement, when a tissue is healing, it gets dysfunctional. It's not as smooth. The lines, the protein fibers are not as straight and aligned as the way they should be. So another technique, which you could do, is you can, so essentially what we did is we started at the neck. You can hold on to something. And now, instead of you bending down, you could just raise up, and let's say right there it's uncomfortable. The height is irrelevant. Just start doing an ankle circle and do some each way. Then when you're done with that, now seeing if you can touch the ground. And so what we're starting to do now is we're just simply adding non-threatening movement patterns. So we let his body, we really want his brain to know it's okay to move without pain. And then over time, we would start adding in the ability to transfer load from one side of the body to the other. It could be like a 10-pound cable, some sort of P&F pattern. And then while you're doing that, then we start bringing in the eyes and we start doing saccades. So we start doing things that get your visual system and your vestibulocochlear function, your inner ear, integrated with the training. I'll be able to do a better job of demonstrating some of that in the gym tomorrow. Yeah. And it's interesting because people flop around. I can't move at all, and all of a sudden, once they connect, you see the same person that was like, discombobulated, and they look like a superstar. They move with precision. And one of the things that recently was shared to me, Usain Bolt's coach, he said something really interesting. All these years later, Usain Bolt, one of the fastest guys in history, I think most people would say, yeah, it's possible. He still does a lot of the same basic drills. And they said, why is he still doing the same stuff? And the coach said, he's still learning. You can never, in terms of your internal body awareness, there's no mountaintop. You just keep going and going and going and going. And the better you become aware, then what you want to work on is, how do I get out of pain through my awareness? So some ankle circles will be another thing. And then breathing. This is a real easy one.
Dr. Donovan, this is something we can hit tomorrow.
Oh yeah, sure.
Let's to be continued,
Yeah.
because I want to get some other questions answered.
Sure.
While
I'm
we're
sorry.
short on
I
time.
hope
Is
that was
cool?
helpful.
Awesome. Sorry.
Yeah.
Just so now you know what to do. Just
Sure, man.
Going back to the topic of the organisms in the mouth, is that a therapy that is long-term, permanent, or is temporary?
Well, so that's an interesting question. So I guess depends how often you might be exposed to those organisms. So
And that
for
was
myself,
question number 2.
yeah.
What's the
So there's so when someone has any of these bacteria I talked about earlier, so about 11 organisms, the standard way it would be treated is antibiotics. So even though it's bacteria in the mouth, it's still an infection. You don't have pus or necessarily redness because you can't see the stuff, but it's still an infection. And the normal medical model would be to take an antibiotic or something. The problem then is you're taking this, you're swallowing this pill. It's going to basically throw off the microbiome around the whole body. It's going to skew things in a way that long-term is not favorable. So I've been recently exploring, I've tested 3 different mouthwashes. So I've tested every organism in the mouth, used a mouthwash, let's see what happens months later, then test every organism in the mouth, use a different mouthwash, and blah, blah, blah. So it's pretty boring. But what is interesting is then you find, so things that we found. So Listerine, Scope, all the big mouthwash everybody use, really bad for you. One of the things that I thought was interesting is the research says, yes, they kill off 99.8 or 9% of organisms, but after 45 minutes, like, I don't know who you guys, but you gargle for 45 minutes, so it's practically not really working. But one of the other things that came out of it is that when you use some of those mouthwashes and they are successful at eliminating the bad guys, they also kill off all the good guys. And one of the things we know, if you kill off everything in the mouth, your blood pressure goes up. So you need the healthy bacteria in the mouth because they produce nitrates that our body uses to help regulate blood pressure. Now, the argument could be made, you could eat some dietary food sources for the nitrates. So we use a mouthwash that basically kills off the bad guys that doesn't have an impact on the good guys. And basically it's a form of chlorine dioxide. We've also could use, we could use a gum that has olive oil and ozone in it, which also does a similar thing. So what I do is we give people about 4 options and we'll let them decide what option they want to use. And then as far as long-term use, I think it might be something people should stay on for a long time because you don't know when you're going to get those bad guys again,
cool. I think we have time for maybe one more question.
No.
Back to what you were saying about the do you get a lot of clients who are autoimmune or they're in some sort of place where they can't figure out what's going on, and that you see as a being an underlying issue?
Well, so if I had to describe a characteristic of our clients, overall, it's people that have been, as far as the non-athletes, most of them are people that have been dealing with a problem for a long time, and they haven't gotten the results, what they were looking for. A good portion of those clients have they were diagnosed with autoimmune condition. Most of the time, they do not have an autoimmune condition. They may have had an elevated marker, like an ANA marker or something like that, and it was diagnosed, but they were simultaneously low in vitamin D. And if you're low in vitamin D, you're gonna have immune dysfunction. Or they were low in some other critical nutrient that would impact how their immune system responds. So while they were diagnosed with autoimmune disease, I would really say that was more of a consequence of the poor nutrition than it was a true autoimmune disease.
So, can I ask one? So, for like a Cyrex blood panel or something, would you recommend the oral organism testing versus Cyrex?
So, well, since you mentioned Cyrex, one of the things I would do is they have a really good panel. So the original test was developed by a scientist from Harvard. It looks at holes in the intestinal barrier. It also looks at holes in the blood-brain barrier. And the really interesting thing is you hear a lot about the gut-brain axis. So basically, there's a lot of mimicry, meaning stuff that happens in the brain happens in the gut and vice versa. What you don't always hear about is the gut-lung axis, and essentially what it tells us, everything's connected. But when I see, for example, NFL guys have a lot of concussions, and we test their blood-brain barrier, they don't always show dysfunction there, but they may show significant dysfunction in their gut barrier. So one of the ways we improve their brain issues is healing the gut. We also find people that have GI symptoms, but we can't find any visible damage in their digestive tract. Typically, those people are categorized IBS or IBD or something like that. And we find they have something going on in the brain. So, I use a Cyrex more for those tests. I think they have a really good food allergy panel. Like I said earlier, I would do vitamin mineral testing first and food allergy later. For the oral microbiome stuff, we use Ubiome, and we use another lab called Oral DNA.
Thank you.
Sure.
All right, Cal, you want to ask? Well, we got to wrap it up. I'm thinking it'll be a quick answer.
So Luke is prompting me to ask a question that I've been meaning to ask for a while. This isn't a technical question. It's more of a personal question. But, I think a lot of people are envious of your capacity to research and be able to absorb information and just in general the genius of everything that you do. And I'm just curious why you chose human performance from all possible different facets of life to really dive into, as opposed to say like astronomy or something like that.
I see. So that's actually I've been asked this a bunch of times, like how'd you get into the situation you're in? So I was training for the Olympics and weightlifting, and I got a parasite infection. And at the time, I weighed 181 pounds, and I go to the University Hospitals, Rittenauer at Penn State, and I'd lost 10 pounds in one day. And I said, something's wrong. Man, I want to say 24, 5, give or take a year here and there. It seems like only yesterday. So what happened was I lost all this weight. I go in, and basically I had really bad, watery diarrhea, and I was just losing weight like crazy. So I go in, and they check my blood pressure, and they check my pulse, and they tell me your blood pressure and heart rate are fine. I'm like, the problem's not in my blood pressure, my heart rate, it's somewhere else, and you're not looking there. And so they basically discharge me, and they say everything's okay. So the next day I lose another 10 pounds. So I'm 20 pounds down in 2 days. I go back and they say your blood pressure and your heart rate is fine again. Discharge me. They don't do anything. The third day I lost consciousness, and now an ambulance is taking me to the same place that basically told me nothing was wrong 2 days in a row. So now I'm 25 pounds lighter, and they go to me, your blood pressure is really low. And I go, that's because I'm losing all this water. There's nothing left. I have nothing to give you anymore. So I think like it feels like there's a tadpole swimming inside me. And I didn't really know anything health-wise at that point. I mean, I was reading Muscle and Fitness back then, you know. So I said, I think there's a parasite or something. Can you give me something to kill it off? And they do a stool test, and everything's negative. So I asked, well, what did you test for? And they looked at me like I was an alien. Like, what do you mean? I go, well, you said it was negative. What was I negative for? And they couldn't identify the organisms. So I said, well, you know, it matters to me, because they told me I need to know it. It's like, it matters to me. So they go, they name like 5 things. I said, well, there's got to be more than 5 organisms out there. What if I had number 100 on an all-time popularity chart? Would you have found that? They go, no, but you don't have it. So basically, you didn't test me for everything, but I'm negative. What you really mean is I'm only negative for what you tested for. That doesn't make any sense to me. No sense at all. So I asked for a doctor, said, I want some sort of drug to kill this off. And he said, I'm afraid of antibiotic resistance, so I'm not going to write a med. So I basically told him, you're an idiot. I need another doctor. So the next doctor that came in, I said, look, man, I'm not shitting my brains out anymore. I want a drug that's going to kill this off, so I go back to my life. So he wrote me a script, and about 2 hours later, I was fine. But I thought to myself afterwards, I had to go through this for 3 days simply because no one knew what the hell they were doing. The standard is you measure vitals, right? But even a standard in healthcare, how many arms, you know, how many points should you measure blood pressure in the human body? At least 2. When you go into any facility, what do they normally do? They measure blood pressure. They typically have a facility, I don't know what the right word is, policy, where they're going to do it. Some places do it right arm, some places do it left arm. Some places will do it both arms the first time. Whatever this arm is higher, that's the arm they use forward. You always want to measure both arms, and if possible, both ankles or something, because you want to look at circulation around the body. That's how you know if there's something going on in the brain and the nervous system. And that's established. It's not like a guess or something. It's very clear. And that way you know what to do. Otherwise, if you're just measuring one, and now you're going to make a decision, put someone on an antihypertensive medication or something, it's a weak reasoning, if you will. So kind of that, you know, I saw some problems with healthcare early on, and then I've had other issues over the years that I just thought, I can't believe everyone's this dumb, you know. But in reality, they are, because they don't have time to think. So imagine if like you're constantly rushing around. Do you think you would operate at your best? No. And unfortunately, what we're seeing right now is we're seeing lots of people stressed out, and the biggest challenges in healthcare is time management. When I talk to doctors all the time, they go, how the hell do you measure all this shit, man? Who has time to look at it? I go, because I tell the person up front, I could figure this out, but here's what it would cost. There's no pressure. You do it or you don't. Because if you say no, I got another guy that says yes. So there's no, issues for me. And what you find is when people are frustrated enough, they start to realize, I'm not going in the right direction. So I'd rather pay someone to dedicate their time to figure this out. And that's kind of how we built this company that's, it's doing really well. We're going to be opening up some locations around the country pretty soon. And I hope to figure out a way to get, I don't think, by the way, physicians are going to be the way we increase health in the country. I think it really is going to be more about personal trainers and coaches. And the reason why I say that, think about time with the person. Average personal trainer spends way more time with an individual than any doctor does. So if I want to make impact on people in a permanent way, I don't start with people that have the minimal amount of time. I start with people that have the most amount of time. Just more, it's more strategic and more efficient.
So I'm going to rephrase the question for you. Callie thinks that you have the capacity to figure out what's on the other end of a black hole, but you're wasting it on people.
Oh yeah, I see. Yeah.
So what's the deal?
Dude, so I've always been interested in health, and I've always felt,
yeah, fair enough.
But I really think someday I'm going to be able to cure diseases with just the stuff we're doing.
Awesome. Hey guys, we are over schedule. So sorry about the bang and clang, but thank you, Dr. Tom.
Yeah. Well, so I forgot to mention I brought some samples of, this is a pre-workout product. I thought we would bust them open and everyone get some samples or something.
Tonight, right now?
Yeah, right now.
No, I don't think that's a bad
I thought we were going out partying. What happened?
So, guys, we also have tomorrow morning with Dr. Tom, so we'll have a little more Q&A and hands-on type stuff, and obviously be, I guess, slamming this pre-workout stuff. But thanks again, Dr. Tom, and good show. Thanks.
Thanks, guys.
So what we're going to do now, guys, I guess